Salam alaikum. Good evening. Myself, Dr. Sujata. I'm the dentist. I'm with Prime for the past 12 to 13 years. And I extend my warm welcome to all the mothers assembled over here. Wishing you all a very happy Mother's Day. Eid Saeed. The word mother itself is so divine and deep that all the words to describe her fall shallow. Mother, she is the embodiment of love. Mother is the most precious gift given to us by the Almighty. And God created mother so that we feel the presence of God everywhere. Mother is a very beautiful and a blissful relationship. Our mother is the first teacher, she is the guide, she is the philosopher, and she is a friend. She is a source of inspiration behind every successful person. She is the source of positivity and energy in our life. And for her source of happiness is always self-service, selflessly she's serving her children. And her family is her world. And she is the heart of the family. So, to respect the mothers and to honor them, we, the doctors of Prime Medical Center Qasimia branch, under the leadership of Dr. Jameel and Dr. Tasneem, we offer you some valuable tips for the well being of the mothers. Over to Dr. Shipra Rai, our internist.
Good afternoon, everyone. Being a mother is the most difficult job in the whole wide world. I think all of us agree. But during the taking care of our families, we tend to forget our health, our well-being, both mental and physical. I'm Dr. Shipra Rai. I'm the internal medicine specialist here in Prime Medical Center, Sharjah, and it's a pleasure for me to address all the mothers here today. When we talk about screening tests, I think what happens generally is most of us tend to forget our health and we don't go for our regular health checkup. The importance of regular health checkup is because some of the diseases don't show any symptoms during the initial period. After a few years, only when the disease becomes uncontrolled do you develop symptoms. So what I would like to stress on is regular health checkups every year, every alternate year, every 3 years, depending on different checkups that you're going to do. The important tests or important diseases that I would like to focus today on would be diabetes, hypertension, cholesterol, and anemia. I think everybody is aware of all these diseases because they are so prevalent. Okay. When I talk about hypertension, the normal BP of any adult person, maybe male or female, is less than 120 by 80. Anything more than 140 by 90 millimeters of mercury needs evaluation. Any woman between the age of 20 to 40 needs her BP checked every 2 years at least. And any woman who's over the age of 40 needs her BP checked every year at least. This is the normal recommendation for every adult female. Okay. Next thing I would like to concentrate on is the blood sugars. When we say blood sugars, usually the normal blood sugar should be, at least when you talk about the fasting blood sugars, it has to be less than 100 milligrams per deciliter. Anything between 100 to 125 milligrams per deciliter is called pre-diabetes. You may still not have any symptoms during this pre-diabetic stage, but you need to be aware that there is a stage called pre-diabetes where the sugars are just becoming uncontrolled, and if we are able to intervene at this stage, you will be able to control the sugars better and make it and control the disease without any drugs. Anything more than 126 milligrams per DL is called diabetes. If you have had any family history of diabetes, or if you're obese, you had history of diabetes during your pregnancy, we would definitely recommend getting your sugars tested every 3 years, at least over the age of 45 years. If you have history of gestational diabetes, it is recommended that after you finish your delivery, every 3 years at least, you need to get your sugars tested. I think this is what people don't know. Once they feel like the sugars are like, you deliver, you forget that you need to get your sugars tested. Okay. Next important thing would be to check your cholesterol levels. Generally, what happens is our food habits and our exercise habits are so bad that these are the most common lifestyle disorders that you see among women or even men for that matter. But what we recommend is any woman over the age of 20 needs to check her cholesterol levels every 5 years after the age of 20. Okay. Because generally, even cholesterol for that matter will not show any symptoms. Only when it becomes too uncontrolled do you develop complications of cholesterol, maybe strokes, maybe heart disease. All these are the complications of having elevated cholesterols. Next important thing I would like to talk about is anemia. I think all of us are aware it is a most underdiagnosed and then untreated diseases, especially among women of menstrual age. Because what happens, most of the women have excessive bleeding, they develop some tiredness and fatigue, but they generally tend to take care of their family first before they start checking themselves. So it's important that if you have any history of like anemia previously, any excessive bleeding during your menstrual cycles, any unaccounted for tiredness which you cannot explain by other means, I would definitely recommend you to go and get your hemoglobin checked. I cannot stress on the importance more of screening tests, because what happens is some of the diseases will not, again, like I'm stressing, will not have any symptoms until it becomes more difficult for the body to control the symptoms. Only then you start developing symptoms. So the important thing is to screen yourself. By ending my talk, I would again like to wish every mother here and whoever's watching right now a very happy Mother's Day. I think being a mother is the most underappreciated job in the whole wide world, and it's the most difficult too. Okay, right now I'll just give it over to Dr. Hiyam, who will be talking more about vitamin deficiencies, I think, which is again very underdiagnosed. Thank you.
Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Good afternoon, all the mother here. Really, it's a great honor and pleasure today to share with you this special moment, which is we are celebrating Mother Day today. As mother has played a great role in our lives, and as we have witnessed during the last difficult days during Corona, how mother they are suffering, how mother they are really strong. Strong, see? Really strong and supportive for every member in their families. Really, I'm very happy also to be like a member of Prime. Now it's about 11 years with Prime Group. I want to introduce myself. They asked me to introduce myself. My name is Hayam. If when anyone asks about my meaning of my name, is strong love. This love, I feel that I'm sharing with all my patients here. I like my job too much. Really, it's a passion for me. And really, I want to support all the women and female which is visiting me in the clinic. Today, I invite 4 of them. I'm happy here. I'm happy too much they are here. Really, they're inspiring me during the Corona time, because all of them, every one of them, have a great story during this time. I'm very happy you are here today. I will finish my introduction of myself. My name is Hayam from Sudan. I really very happy to practice the medicine in 3 countries: Pakistan, Sudan, and here in UAE. Today I will start talking about vitamin D, vitamin B12, which is really very important. It is a very wide topic, but I'll try to look for it in the woman life. Vitamin D and vitamin B12 is very important in all stages of the woman life. I will start by vitamin D. Vitamin D is a hormone. It is there in our body. We can produce it by our body, but when the enough sunlight, it is there, and we can expose to this enough sunlight, and then it can convert to active form. Then we can benefit from that vitamin D. All the female, they come to our clinic having 3-4 symptoms: unexplained fatigue, tiredness, headaches, sometimes depression. Because vitamin D have role in all this, in boosting the immunity, in the bone supportive, because it is help the calcium absorption in the body. Maybe you will ask, what is the vitamin dose I should have it to be healthy? It is between 30 and 50 international units. Some ladies, they tell, we are exposed to the sun, we are taking enough vitamin D, but still we feeling we are not benefit from that, because vitamin D, there is many diseases affecting the absorption of that vitamin D, like gastrointestinal disease, like Crohn's disease, ulcerative colitis disease. Also, there is sometimes we are not exposed to the enough sunlight, because we don't know when exactly we should go to where and how. So it is between 10 and 3 p.m. Okay, we should expose to the sun in this 2 hands, okay, face and back also, and 10 to 15 minutes 3 times a week. And also, it can be also not enough, because this is different from country to country, different from place to place, and the temperature also, and the darker the people with when they have dark skin, they need more vitamin D to be supported. Vitamin D also deficiency can lead to very famous condition like osteoporosis, which is facing to the women after 45. also can cause depression, can really affecting the infertility, affecting the pregnancy. So I'm advising all the women when they feel that simple, unexplained fatigue, tired, depression, and also it is affecting really her fertility and sexual life. Really, it is affecting also all these important places. And always we will advise the women, don't be embarrassing to just show us all the things they are feeling or anything they are without any embarrassing. Again, I will go to vitamin B12. Vitamin B12 also, it is a really embarrassing us day by day because it is affecting our mood, affecting our energy, affecting also our health, like hair, skin, also the nails, which is really very important to the woman nowadays. They're too much affecting. If you have little bit deficiency in vitamin B12, you will start having the same unexplained fatigue, tiredness, but maybe you have tingling. Okay, in the periphery, you have numbness. Also, again, you have unexplained fatigue. It is very important during the pregnancy life, important during the lactation also. Vitamin B12 deficiency can lead to many diseases. First, megaloblastic anemia, which is really hidden disease, but it's very important to because it is difficult to treat. Also, vitamin B12 also is affecting nowadays the memories. Sometimes we feel we are not concentrating, we are not focusing in something because it is really supporting the central nervous system, support the brain. So really, it is very important to have the enough dose. If we ask about the dose of vitamin B12, it is 2.5 microgram. This is daily, but some ladies maybe they need it more during the pregnancy and lactation. There is also some difference between the two. Vitamin D, when I can, if anyone asks when I can use the vitamin D, I can use vitamin D after meal in the morning, after fatty meal, because it is one of the hormone which is absorbed in the fat. Because of that, some ladies they ask about why they are not reducing the weight because they don't have enough vitamin D because it is hidden or isolated in the fat cells. So when we have enough vitamin D, okay, we can reduce our weight very easy. Again, vitamin B12, when I can use the vitamin or take the vitamin B12 pills, I can take it in the empty stomach half an hour before the food because it is a water soluble vitamins. I'm very happy again to meet you all. I hope that all of you, if you have anything, be open with your doctor because this is very important. Because really, all the female, all the mothers, they are keeping themselves till the end, and really, they have a very big role. Okay, in their children' life, their husband lives, they should always feel fit, very active, and don't feel depression in any stage of their life. Today, with the Women Days, with the Mother Day, it is a World Watery Days. So I want to just give you this gift. It's a poem written by myself, but it's in Arabic. I hope you can feel it also. سنبلة أنا بل أبدا بل حقل قمح وردة واحدة لا تكفي لوصفي بل حدائق جم أنا وفراشات جذلى وألف حكاية سحر في الحنين في الطريق وخلف ألف باب أنا الكتف في الهم وفي حزن المسير أنا الرفيق أنا الرقيق وبعض شعر أنا في الثورة أزهر ألف بنت أنا في الثورة الوطن الجديد. I'm happy to meet you all. Really, I want to have a little bit time in the end just to really share the story of my patient. But I will tell Dr. Farol to come to share with you. This is important for making the skin.
Thank you, Dr. Liam. I think towards the end, we would like to know the meaning of this poem. But indeed, it sounded very well. One more. I'm Dr. Parul, working as a specialist dermatologist in Prime Medical Center from last 12 years. This is the 13th year. A very good evening, marhaba, to all beautiful mommies who are attending, who are online. So today's Happy Mother's Day, yes, indeed. But along with that, I would also like to tell you something about one of my patients. With this, I would like to take an opportunity even to say thanks to her because she was the one who gave me this wonderful idea of presenting this particular topic. During her last visit, she jokingly mentioned that she believed the best gift she could receive from her daughter was a way to maintain a youthful appearance. And she knows whom I'm talking about. So thank you, Ms. G. Dinah, yes. As sometimes the smallest thing can have the biggest impact in our lives. Hence, I would like to start off by discussing about few important aesthetic procedures, as list is long, but we would like to focus about few topics which are commonly asked. So the first thing would be PRP. The PRP is basically known as platelet-rich plasma therapy. This is basically our own blood. We filter the cells and we help in healing our skin. It's just not the skin. We are using basically in many conditions to heal the bone, for grafting, for many other purposes we are using it. But in skin, basically, we are using it for hair fall problems and skin rejuvenation. Along with that, the second most thing is scar rejuvenation, acne problems, and all those things. The second commonest one is Botox. I think all of us know about it. The small droplets of injections are used to remove wrinkles from the forehead, from around the eye area, on the neck bands, the platysma. Of course, these are because they are not much invasive. That's why the effect is not long lasting. But yes, it varies from person to person. In some people, it is 4 months, 6 months, and at times it even lasts for 8 months as well. The third commonest one is fillers. Fillers are basically hyaluronic acid injections. The function is to fill, as the name says, filler. So it basically serves in filling the hollow places. It can be cheek, it can be the under eye area, it can be the neck area. At times, it can be even the hands if you have any hollowness in the hands, which come after aging, after a certain age. The threads, basically, they are thinner than the hair, and it is also called non-surgical facelift. These are made up of PDO, polydioxanone. They basically help in lifting. The lifting effect can be seen whenever there is a drooping of the angle of the mouth, where we see sad face. So basically, to give a happy face. Sometimes the jawline drops. Sometimes we have the double chin. So all these things, if you want to lift without going for the plastic surgery or under the knife, this is a very good option. The fifth one is called mesotherapy. This is infusion of vitamins basically into the skin. And the function is to remove pigmentation. And the second one is to restore luster and skin tone. I wanted to present some pictures as well, pre and post pictures. Probably we can do during question and answer session, that would be more clear. So thank you very much. Thank you for coming in and being such nice audience. I would hand over to Dr. Goka, one of my very good friend and colleague. She will talk about a few very important topics.
Good afternoon. I'm Dr. Sanandini Goka, gynecologist, lactation consultant, working in Prime for more than 12 years. It's my pleasure on this day, Mother's Day, to congratulate all of you. So, as mother is important to us, her health is important to us. We here in Prime take care of her health through our efforts and care. So, as in Prime, we say personalized care personally. When we talk about mother's health, we talk about screening. Screening, there are certain important screening tests when we talk about the mother and the women in you. The screening tests, which are very important, are the simple screening tests, which I would like to share. The most important screening tests we do routinely in our clinics are the pap smear, the HPV testing, and the mammography. When we talk about screening, screening is basically to pick up any problem or a cancer at the earliest so that it can be treated very easily and very effectively. When we talk about pap smear is a simple test which is done in the clinic where the doctor takes the cells from the cervix of the uterus to examine for any changes that can lead to cancer. Pap smear or a pap test is advised or recommended every 3 years. It is very simple and cost-effective test. When we continue the screening, as we say, if we have an availability of HPV testing will give an advantage for the efficacy or efficiency of the test. Hence, if we do a pap smear alone, it is recommended every 3 years, starting from 25 years through 65 years of age. And if the pap smear with HPV co-testing, it is done, the recommendation is every 5 years. When we talk about HPV testing, what is HPV? HPV is a human papillomavirus. The human papillomavirus, there are around 200 types of virus. There are high-risk categories and low-risk categories. When we talk about human papillomavirus, there are 70% of the human papillomavirus can cause cervical cancers. Human papillomavirus can be self-limiting, but when it persistent, it can cause or lead to cervical cancer, vaginal cancers, vulval cancers, anogenital cancers, oropharyngeal cancers, penile cancers, and vulval or warts or genital warts. A quick look into HPV vaccination. I'm not going to the details of HPV vaccination, but we have 3 good different types of vaccine: the Cervarix, Gardasil, and Gardasil 9. All 3 are very effective and can be started as early as 11 years of age. As we go into the depth of the next level of screening, we talk about breast cancer screening. Again, I insist on the fact that screening is very important, as we can pick up the disease or a cancer at an early stage when it is easier to treat. As we talk about breast cancer screening, the common things which come to us is clinical self-breast examination, clinical breast examination, and a mammography. Self-breast examination. We ask all the mothers or all the women from the age of 25 years to check their breast after their period every month. And the clinical breast examination is when the doctor in the clinic examines thoroughly after taking a detailed history about the risk factors for any breast cancer. Then the next level of screening and the best screening for breast cancer screening is mammography. And the recommendation for mammography is from the age of 40 to 49. It's the decision after taking a detailed history, examination, a decision made by the woman and the doctor for the necessity or the need for a mammography to be done either every year or every 2 years. But from the age of 50 to 59 years of, from the age of 50 to 74 years of age, mammography is recommended every year or every 2 years. After 75 years of age, the decision for mammography will depend on the health condition of the lady. So, as I close my topic with the basic or common screening tests we do in our clinic is the pap smear, HPV testing if available, and a mammography. Before I close my topic, I just want to say a few words on breastfeeding. Breastfeeding is the connection and the bond between the mother and the child. It's a way of mothering your baby. Breastfeeding is going to give you the health and the benefit, not just for you and the baby. Exclusive breastfeeding for complete 6 months and continued breastfeeding for 1 to 2 years is going to give all the health benefits to the baby. And every year of breastfeeding can decrease the incidence of breast cancer. With this, I end and I hand over to Dr. Nancy for the next lecture. Thank you.
Good evening, everyone, and a very happy Mother's Day for everyone, for my mom, for you, for our online audience, everyone. أحبت بالشعر أن هيا فلباني في عيد أمي وفي آفاق روضتها وجب علي أن أوفي بعض عرفاني. رأيت في عيدها الدنيا يجملها فصل الربيع فجاءت عطر ريحان. لو أن حادثة باتت تؤرقني لبات طرفك مضني غير وسنان. أو أن هما عميقا بات يثقلني حملت عني كل أشجاني وأحزاني. إن عزفت غضوبا كنت باسمة ووجهك الطلق بالغفران يلقاني. أماه لست أوفي بعد مكرمة ولو أضفت بإطراء وشكران. أماه أنت حياتي وأنت منبعها لولاك ما كنت في الدنيا بإنساني. حملتني بجوار القلب حانية وصنتني في حنان وأحضان. Me myself, Dr. Nancy, specialist pediatrician. I finished my graduation from Egypt, Ain Shams University. I am here with Prime for last 8 years. I am a mother of 2 boys, one 13 and one 14. Actually, when my big son was born, he was just about 1 month. So I left him. Then I joined my work as every working mother. So the first advice for my mother is breastfeeding. Breastfeeding. You have to go for breastfeeding. Why breastfeeding? Because breastfeeding, this is the natural gift that God's gift to every mothers, just to give it for your son, okay, or for your daughter. And even it called the perfect food, okay, because it is very important for your baby digestive system. It's very important for his mental health. It's very important for everything, for his development all over his life. For the first few days after birth, the mother breast make a very thick and sticky form of the breast called colostrum. Colostrum has very important nutrients and antibodies that your baby need in his first day of life. 3 days after the birth, colostrum replaced by transitional milk. The transitional milk, which is look like a mixture of orange juice and milk. So it is like between the colostrum and the normal milk will come later on. This is the stage between the colostrum and mature milk. Later on, after the 2nd week, mother will start having the milk, the normal milk that she will be having for the next 2 years. Okay, it's a white and slightly thinner than the transitional milk. So what is the benefit of the breast milk for the babies? Breast milk is always ready every time. Whenever your baby needs, you are there. Okay, breast milk provide all the nutrients for your infant. It is a mixture of vitamins, proteins, fats, and normal antibodies. And it provide more than a very easy digestive system for your baby. And it's protecting your babies from asthma. Because most of the babies here in UAE and Gulf, they are having too much allergy. So breastfeeding is the main source of protecting your babies against this, allergic diseases and everything. So like without using the breast milk, maybe the baby can face some problem later on. So it is very important for his first 2 years of life. And it is avoiding the babies to go to the doctor and hospitalize, especially in their first 2 years of life. Breastfeeding also have very linked to high IQ for the children score, because later on in childhood we have studies between the babies who was breastfeed and the baby who were in formula. So we can see that the baby who were under breastfeed, they have more IQ than the other babies. Breastfeed also reduce the risk for sudden infant death syndrome, because the babies with breastfeeding is having less normal sleeping behavior, so they are less liable to have this sleep death syndrome. Now we can come to the benefit to the mother. So what the mother can benefit from the breastfeed? Actually, we have very good trials we are doing in the hospital. If the baby, for example, delivered before his time, premature baby, and sometimes they are facing some premature problem, so we are bringing the baby to the NICU and putting the baby in the kangaroo position. So skin-to-skin contact, it has proven a marvelous effect and progress in the baby. So the baby can listen to the same heartbeat that he was there inside you for the 9 months. Skin-to-skin contact, it is very effective for treatment, for enhancing the baby progress and growth and everything. So it's very important for mother. Oxytocin also, it's produced while you are breastfeeding. Oxytocin is very important because it's protected the woman from the breast cancer, ovarian cancer. So, and it is regulating also the mother's stress. Breastfeed also reduce also the risk for osteoporosis. Breastfeed help the mother to lose weight. So it's very important. Making milk for one baby required approximately 500 kilocalorie for the mother. So imagine in each and every time she's breastfeed, how much she can lose weight. So I would like to advise all the mothers for going for this a very natural and God-giving habit, and wish you a very good Mother's Day, and thanks for all mother attending today the online. We are very blessed to have you here. Actually, I'm having very wonderful mothers who's really inspire us from before and from nowadays, also in Corona and in the futures. We are very happy in Qasimia to have all you wonderful mothers. And I just end with a small poem for my mom, for all of you. For all the things I didn't say about how I felt a long way, for the love you give and the work you have done. Here is appreciation from your admiring one. You cared for me as a little tot. When I did was a cry a lot. And I grow, your work did too. I ran and fell and got black and blue. I grew some more and it didn't stop. Now you had to become a cop. To worry about mistakes I have made, you kept me in the line for my own sake. I got older and the story repeated. You were always there whenever I needed. You guided me and wished me the best. I became wiser and I know I was blessed. So for all the things I didn't say, the love I felt for you each day, Mom, read this so you can always see just how much you mean to me. Thank you. So we are opening discussions from the mothers. If you have any questions for me, myself, for my all colleagues, you are welcome to have any questions. Any comments? Yes, please.
Can I speak in Arabic?
Sure, sure.
أولاً كل عام جميع الأمهات وجه تحية كبيرة للدكتورة ليام، وطبعاً لها من نصيبها اسم أكيد زيارة اللغة العربية من دراسة العربية والحب الكبير أو أقوى درجات الحب. فطبعاً التعامل مع يعني أنا شخصياً كنت مع الدكتورة ليام تتعامل كإنسانة قبل أن تكون طبيبة، وأنا بشكرها جزيل الشكر على الدعم الكبير اللي قدمته إلي نفسيا قبل العلاج، وفعلا يعني شعرت بارتياح كبير، وفعلا الراحة النفسية بالنسبة للمريض أهم بكثير من العلاج. فوجدت فعلا، وحتى في مركز برايم هناك مواعيد الدقيقة والتعامل الراقي من قبل الجميع، حتى الممرضات والعاملين وجميع العاملين أيضا. بشكرهم جميعا، بوجه تحية لكل الموجودين هون. كل عام وانتم بخير، وان شاء الله في العام القادم نكون قد ذهب عنا هذا الوباء الى ان شاء الله. اول سؤال دكتور نعم، بما انه فيتامين د هو المتصدر كل المكان يعني وجميع الاعمار، ونتناول احنا هذه الاقراص كما يوصف لنا الطبيب. هل هناك اعراض جانبيه لتناول هذه الاقراص مثلا؟
This is a good question. She's asking about if I took the pills in a regular base, this is have any side effect? Yes, this is depend upon the first at all. We should know how much you're deficient. We should make a blood test, knowing that which exactly where in which category you are. You are too much less in vitamin D, or you are insufficient, or really you are severely need to have a vitamin D, because in the market you cannot go to the pharmacy and took like 1,000 or 5,000 or 10,000 by your own. You should do this blood test first and to know exactly how much you should take for your case. For example, some people, they have insufficient. As I told you before, 30 to 50, it is the good range for everyone. So if you have, for example, 22, that's insufficient, not that much deficient. So you will take 5,000. For example, you are 9 only. Okay, so maybe you will take 50,000. So for example, you are okay and you become 30 to 50. After that, you are regularly taking the 10,000 per week. You will not feel any kind, but some people, they feel constipation, dizziness, sometimes fatigue and tiredness, sometimes swelling in the face and in the feet. But this is a rare condition. Some people, before we are going to the doctor, also we should check the kidneys. Okay, because very important, because the vitamin D, it is attached with the calcium and can too much extra dose can lead to hypercalcemia. Hypercalcemia, this is toxic to the patient. Because of that, we are advised some patient, they are coming, we need to take this injection. The injection having 300,000 international units. When I give it suddenly to the patient, I don't know his condition, he's having any kidney problems, having any disease. I cannot give it to him to the patient like this. We should first check the level. Okay, after that it will take 3 months. After this 3 months, you should be under maintaining dose, daily dose. What is the daily dose for the adult? It is between 1,000 to 2,000 international units. So you should take only 14,000 per week. So this is the simple about the complication or side effect of the vitamin.
Thank you. Shukran.
Yes, please. Yes, please.
Good evening all. My name is Hanifa. I have a question for Dr. Shipra and Dr. Nancy.
Yeah, tell me.
Dr. Shipra, please guide us about little bit on thyroid.
Okay.
Okay, what are the symptoms, how it is developed?
Mhm.
And some people say that in the pregnancy you get the thyroid, after pregnancy it will go on its own.
Mm.
But in my case, I'm still having a thyroid. Okay, so I need a guidance on that.
Okay.
And Dr. Nancy, you talked about the breastfeed. I have 2 sons, but from first day or 1 month itself, my breast milk has stopped. So both of them are on the formula only. So can you guide us on why it is stopped in the mothers, or it is not coming to some of the mothers? What are the causes, and how to again start the breast milk if it is not coming? Thank
Okay. First, I think you asked me the first again. Okay, when we talk about thyroid diseases, the most common thing is, I think, hypothyroidism. That is the one which you're worried about. See, when you say hypothyroidism, generally means the symptoms will be there. You'll have unexplained weight gain. You can have constipation. You might have cold intolerance. You might develop some menstrual irregularities. That is the most common symptoms of hypothyroidism. But generally, when you talk about the cause also, usually there is like, it might be multifactorial. But the most common reason is your body reacting to your own thyroid, and it goes and destroys the thyroid gland. Because of that, what will happen is the thyroid hormone that is supposed to come out of the thyroid gland will not come. So because of that, you develop deficiency of thyroid hormone and you can develop hypothyroidism. This is the usual reason why thyroid disease is common. The next question what you asked me was whether like hypothyroidism that develops during pregnancy can revert back to normal. It is a common occurrence because usually what happens, your thyroid hormone requirement during pregnancy will go up. That is a common physiological phenomena because your baby also utilizes that much thyroid. Okay, there is a chance that your thyroid can go back to normal, but again there is also a possibility that if you were hypothyroid to begin with, you might go back to your original dose which was there previously before thyroid disease. Okay, so you will only know once you finish a gestation period after your delivery. We keep checking whether your thyroid disease is still persistent, then only we'll be able to tell whether you need thyroid hormone replacement or not. Okay. Yeah.
Yeah. Now, yeah, let me answer her question, her part, then I will give you the question. Okay. So regarding your question regarding the breastfeed, and some mothers, they are facing this problem that after delivery, they don't have milk or they have a difficulty in feeding their baby. So ideally, when the mother, she is in the late pregnancy, with her gynecologist, we are advising her to do some exercises or some, massage for this area. So just to promote the bringing of the milk, because the hormones start in the late pregnancy coming out. So the milk flow, you can feel it also in the last months of pregnancy. So by doing massages for the areola and this part, you are enhancing this area to be ready after the baby is coming out. Because some mothers, they having the problem with this flat nipple. So when the baby delivers, they are facing too much problem. But still, we can use the shields for the baby to suck, for example, if this is the reason. The second thing is that you are saying some mothers, they don't have milk. So we are giving something first natural to promote their milk by drinking something warm, by drinking too much fluids, too much water. This is enhancing too much the mothers immediately after delivery to bring their milks, especially before the feeding, okay, each and every time. Because whenever the baby is sucking from you, the milk will come and the milk will increase and your uterus will come inside again and the oxytocin will be more. So it is a cycle. Okay, this is the thing. If this all failed, then your gynae doctor, she can give you some pills naturally also. It will enhance your milk to come out. Okay, because some mothers also, they are not allowed after delivery because of some medical diseases to breastfeed. So this things we cannot do anything, because if mothers coming for me and telling I cannot breastfeed my baby because I have some medical problem, so I cannot make her suffer and make her son suffer also. So we are giving the formula as a alternative, or if she's having some local problem, we are telling her express your milk and keep it for your baby. Okay, thank you. Okay, welcome. Your question, please.
Yes, this is Vilka here. And first of all, everyone wish a very happy Mother's Day to all of you. And Dr. Hiram, I'm visiting her and she is very nice. I have one question about the heart blockages. Like how we can prevent, how we know there is, because this is inside in the blockages, right? So what are things we have for there is any symptoms, or what we can understand there is any blockages in the heart? Because I faced last year only, there is this problem in my family and I lost my father. So I was not knowing anything about the blockages. The end of the day, when we go for the ECGs and all, we find out there is a 5 blockages. So like what is the symptoms and how to control this? Or there is any any checkups, routine checkup we have to keep on that to avoid these conditions? So I just want to know about the things which I faced before. So I want to know like how we prevent this.
Thank you, Vina, for just being with us today. And really, when I choose my guests today, all of them they are facing a difficult time, but they are really strong women. I'm really appreciating you all, because you are just choose to be strong. You can choose to be but you choose to be strong woman. This is a very maybe we can say specialized questions. I will give it to Dr. Shipra.
Okay, that's a great question actually. See, I think it varies from age to age. Generally, what the understanding is that women are generally protected until your menopause. Okay, because estrogen is always protective for your heart. So 90, more than 90% of the times, women generally don't develop any heart disease until menopause. Okay, after that only. If you see men develop heart disease at around 40, 45, they have MIs. But women develop later. That's the most common thing. But for you, like when you asked me the question, you said what all screening tests we can do. That is why I was stressing on the importance of screening. Whenever you talk about screening, it means like there are multiple risk factors for heart disease. There are modifiable risk factors, there are non-modifiable risk factors. Non-modifiable basically means even if you do something, it's not going to change the outcome. But there are certain things that you can keep looking for to prevent the heart disease from happening, especially when you talk about diabetes, which increases the risk of heart disease at least 2 or 3 times. The next thing is your BP, blood pressure, and your cholesterol checking. I think these are the most important things when it comes to women. So whenever you talk about your blood pressure, like I said, you need to keep monitoring it regularly. If you're, especially if you've been having blood pressure during your pregnancy and all, you need to keep monitoring blood pressure regularly. Next thing is about your sugars. Again, like after the age of 40 or 45 years of age, you need to, at least every 5 years, you need to get your sugars tested. And again, if you had diabetes during your pregnancy, it's mandatory. It is mandatory to check your sugars every 3 years. Okay, just to make sure that you're not developing sugars later in life, because again, gestational diabetes, that is diabetes that develops during pregnancy, has a high risk of developing sugars later. Okay. Cholesterols again after the age of 20 years of age, again you need to check every 5 years. And including all that, suppose you start developing any symptoms of unexplained chest pain that you're having on the left side, or any unexplained gastritis which is not getting relieved by your antacids that you take regularly, go to your doctor, get yourself checked, at least the basic investigations. Then if required, the doctor will assess your symptoms and ask for an ECG. ECG and a blood test, something called troponin. So if there is anything abnormal with that, they'll ask for your echo and your TMT. These are the next level tests which are recommended for heart disease assessment. But generally, what helps with heart disease prevention is screening every time. It's a mandatorily important that you screen yourself for diseases, because you, again, like I said, there may not be any symptoms until your body is not able to control the symptoms on its own. Then only you'll start developing symptoms. I think that explains your. Okay. Yeah.
Mr. Farah, do you have any online questions?
There was one question on HPV testing. As we say, HPV testing is recommended every 5 years, starting from the age 30. But when we do pap test, we say we start the screening at 25 years and recommend every 3 years.
One more question?
Yeah.
I'm very happy for this trip, everybody. Thank you for having us here. My question is for ma'am. I don't know your name.
My name is Hayam.
Okay, ma'am. My mom has she's affected with this osteoporosis.
Okay.
So she is she takes tablets, but that doesn't suit her, like calcium tablets, vitamin D tablets. Almost all the tablets doesn't suit her. So doctors give
How
her
old is your mother? Above 70 or 55?
So now she cannot walk because of her knee pain.
Okay.
She always rests. So what I say her, you don't sit like that because this will make more worse.
Okay.
But she says what to do because the calcium, vitamin D tablets doesn't suit me. Neither milk suits me. If she has milk, she'll have gastric problem.
Okay.
So what can you suggest?
First of all, I will ask her what is the meaning of not suiting me. She's not taking the
No, she'll
vitamin.
have reactions. One day
Okay.
I can explain one situation. She had one this supplement tablet. We had to rush take her to the hospital.
Okay.
She bulged her face. She had swollen legs. So then they gave her antibiotics and all. But how can she
See, the osteoporosis, have degrees. يعني it should be degree 1, degree 2, degree till 4 degree. And this is have a specific kind of test she should do, bone scan. According to the bone scan, we can just go through the treatment. Of course, the not only the vitamin D or calcium, this is maybe in the first stage, but there is a specific kind of medicine which is need also to be under supervision. Okay, because this medicine is affect maybe the kidney, affect maybe the liver. She should be under the evaluation of the doctor. Also, this is also very important for all the women here. There is exercise for every age. Okay, maybe I ignore the exercise, but this is very, very important in our life. It is really increase the mood. It can keep you, keep you always fit, keep you also happy with your health, happy with your figure. Okay, and also it can always delay the complication of the disease. Okay, but in your mama stage, okay, she should see the specialist, okay, to see which degree. I don't know. To see which degree of the osteoporosis is there, and accordingly the treatment is there. If she cannot continue with calcium and vitamin D, which is very important, she will go for the second line therapy, which is need also a very detailed supervision. So don't keep her like this, and even you can ask the specialist which exercise can keep her fit.
She goes for physiotherapy.
Okay, but she should see the specialist first at all. Yeah, of course. What kind of replacement? Because she's have very rare maybe allergy to calcium or vitamin D. It's a very rare condition. It will be a rheumatologist. She should see the rheumatologist.
See, one thing what I would actually add to what Dr. Hiam said, there are other options to osteoporosis also. There are some injections that can be given, especially alendronate, which are given once every few months. So it might be convenient for your mother who is not able to tolerate anything orally. Yeah, that might help her. See, the best person would be to consult with an endocrinologist and seek a consultation that way, and then see.
Go to endocrinologist because she has diabetes.
Yeah. So you can consult with him regarding that injections, because some other injections are there which can be given once in 6 months, once in 1 year. That also is an option, because if she's not able to tolerate. Okay.
Thank you.
Yeah,
Thank
yeah,
you
no
so
problem.
much.
This is my question. If the vitamin D is no, there is no maintenance dose, daily maintenance.
Yeah, daily maintenance is between 1,000. See, by my clinic, it is 600 international units. Okay, but daily, yeah, it is 1,000 to 2,000 for the working woman. 1,000.
Working woman
Yeah.
is
Working women mean active women,
Active
sexually
woman.
active. She's going outside. She's having work. It is 1,000 to 2,000 international unit per day.
and B12, it's okay.
B12, but there is a daily. There is a 2.5 microgram. Okay, and you can take that small pills. Okay, B complex. Really, B complex having really you can energize you. Yeah, give you that much. More very good.
أنا مش مجهزة حالي. I'm not ready, but I'll try to speak in English.
Yeah.
My experience with Prime Medical Center, I've been dealing with Prime Medical Center for more than maybe 10 years. I feel like I'm a family, one family. Me, my family, my friends. I even recommended most of my friends and family to come to Prime Medical Center.
It's true, ma'am.
And I'll speak my experience with Dr. Farah. She is really, she's my hero. I came to Prime Medical Center. I have very stressful life. She knows very stressful life. Even I lost my hair here, alopecia, and some stress. Even my body. First, I saw Dr. Carol. Believe me, she gave me a very high moral. She gave me positive. I've been dealing with Dr. Carol more than 10 years. You know, I want to cry because I really was. Don't cry.
A big smile.
Yeah, please.
Is
Love us for me. I lost my husband was sick. I lost my husband. I even lost my hair. I had depression, and even I have like skin problem. I have. But Dr. Carol, she supported me a lot, and also she's as a doctor, she is really among in Sharjah. She is the best, not for me only, not only me. You are proud to have Dr. Carol as a member here because you know my daughter, she had a skin disease. I took her to so many doctors. No one diagnoses the right. Only Dr. Carol. Not only my daughter, other friends. Also, I want to say about Dr. Carol as a person, not as a doctor. She is very kind, very helpful. I don't know. No words can explain about Dr. Carol. You know, she gave me the positivity. I'm feeling much better. Even I start doing my I'm now 55 years old. I'm taking care of myself.
This is the message actually. This is the message we want to deliver.
You know, even my daughter, she said, I asked my daughter, I want Mother's Day buttocks.
Actually, everyone needs that.
I've been dealing with all the doctors in Prime Medical Center. They are really very good, the best, and I feel home. You know, I usually see I'm doing, but I feel home. But today I wanted to speak about my experience with Dr.
Thank you.
I came, I'm feeling much better. Like she gave me, I'm feeling more strong. Whenever I talk to her, I come to visit her. I'm really thank you, Dr. I'm medical center should be proud to have Dr.
We have few more questions for Dr. Farooq. For me, my hero is Dr. Gokam. This was the first pregnancy. My mom, nobody is here, and I also give cheer up to the nurses in Prime Hospital. They're very supportive, like mothers. And giving the 6-month-old baby,
So sweet.
only because of her strength, I could sustain this. Thank you so much. Every night, whenever you make a call, even in the night, night she would pick up.
Yeah.
And when I was having this pain, labor pain, she used to be in contact. She used to have that my contractions and all. She used to check from here. Nobody does this. Thank you so much. Thank you so much. When you don't have your own families, this is where we feel.
Thank you so much.
Thank you.
Yeah.
Yes, thank you. First of all, I would like to thank all the primary center and all the doctors present here
Yeah.
to arrange this on the eve of Mother's Day.
Yeah.
Definitely, whatever knowledge we have acquired will be beneficial for us.
Okay.
Yeah, regarding, I wanted to ask Dr. Boka regarding pap smear and mammogram. What age we have to do that and how often?
Yeah, pap
And,
smear. Yes. Yes, go ahead.
Yes, ma'am.
Yeah, pap smear we recommend starting from age 25 years, and it is recommended every 3 years.
So we have to start at 25,
Yes, 25 years.
every 3 years. And
And
mammography, ma'am?
mammography, it depends. Okay, when we say about 40 to 49, it's the okay based on your history evaluation by the doctor. A combined decision is taken about the decision for mammography to be done every year or every 2 years. But from the age of 50, mammography is recommended every year or once in 2 years.
Mammography after 50, you said?
Yes, from 50 to 74 years.
Okay. Ma'am, one more question, ma'am. Ma'am, we want to conceive after 40. I have already 2 kids. If we conceive after 40, the chances of like blood pressure and diabetes and other complications, is it more after 40 or can we have a normal pregnancy after 40?
See, when you talk about pregnancy at 40s, so we need to look at whether you have comorbidities before you start your pregnancy. Of course, getting pregnant without additional comorbidities is an advantage, but the risk of the congenital anomalies to the babies are increased when one conceives at 40. So, in addition to your comorbidities like diabetes or hypertension, that adds to the risk of the baby having more problems if they are uncontrolled.
So, ma'am, any precautions we need to take? Suppose we are conceiving after 40, the third or the fourth week.
Vitamin D and B12.
Yes, first thing is you will have to see the physician to see if you have any other comorbidities like hypertension, diabetes, any other medical problems. Okay, so that can be treated, and those medicines, if you are already on, can be changed to a medicine which can be continued throughout pregnancy. Okay, the risk for the babies with the age itself cannot be lessened, but there are certain tests where we can go for the screening to say whether the baby is fine, but it cannot guarantee all the everything fine with the baby.
Okay, ma'am. So you mean to say it's better if you're planning for the third or fourth baby, suppose we are after 40, it's better to consult first and get done a checkup.
Yes, ideally visit the physician and the gynecologist together to find out whether you require some basic screening tests before you start on. And we advise folic acid from 3 months before you start plan for your pregnancy.
Okay, doctor. Thank you so much.
Thank you.
Thank you so much. Thanks to all the mothers who have assembled over here for your active participation. We really appreciate it. At the same time, I thank all the mothers who have been watching us online, virtually. And we appreciate your time from your busy schedule to make this event a successful. This is not the end. We will come up with more for the mothers and we appreciate your participation. We are really blessed to have you all over here, and this will remain as a memory for us forever, and we are here to serve you even for the future. Thank you so much, and wishing you all a very happy Mother's Day. Thank you.
Want to give some gifts?
Yeah, we have some.
Just 1 minute, please. Just we would like to thank